Our next talk is from Dr. Freya Brown. She works at King's College in London. She has a background in paediatric nursing, but recently she's been doing some specific research into, and this is where I learnt a new word this morning, splanchnic. So thank you, Claire. It's pronounced splanchnic vein thrombosis. I don't know too much about that, but I'm hoping to learn more in the next few minutes. So welcome to the stage, Dr. Freya Brown. Thank you.
Thank you. Thanks very much. So hello, everybody. As said, I'm Freya, and I'm a researcher at King's College London in the Faculty of Nursing, Midwifery and Palliative Care. And today I'm presenting a study which focused on exploring experiences of people living with myeloproliferative neoplasms associated splanchnic vein thrombosis, or fortunately MPN SVT for short. So this study is led by Vicky Tsianakis, who is also at King's, and other members of the research team are colleagues at the Royal Free Hospital, Malika Sekar and David Patch, University of Surrey, Joe Arms, and two people with lived experience of the condition, Mandy Lomax and Colin Mitchell. The majority of the funding for this study was awarded by MPN Voice, with some also coming from the Royal Free Charity. So a massive thank you to MPN Voice for funding the study and also for inviting us here today to share our findings. So MPN SVT is a rare condition with only around 500 to 800 cases in the UK. Primarily it's diagnosed in people under 50 and more women are affected. It involves blood clots in the abdominal veins, which is the SVT, and this is secondary to an underlying MPN, and it can affect the portal, splenic, mesenteric, and hepatic veins. The diagnosis pathway is unique because the blood clots in the abdominal veins often appear before the MPN is diagnosed, and early treatment is absolutely critical for improving outcomes. And standard treatment is lifelong and includes anticoagulants to prevent new clots and chemotherapy to manage the MPN. So managing MPN SVT is complex and requires coordinated care across multiple providers to address the risks and complications of both conditions. And often several separate teams are involved. For example, MPN and thrombosis clinics, GPs, and specialists such as hematologists, hepatologists, and gastroenterologists. And this setup presents challenges for patients and for clinicians and can lead to fragmented care. So many people with MPN SVT face lifelong challenges from clots, the MPN, and liver and intestinal symptoms. And as mentioned, because care pathways are often kind of complex, it can lead to inconsistent care and gaps in support. And added to this, there is a lack of quality data on patient outcomes and disease burden, although we now have the MASCOT registry, and no published literature to our knowledge on the experiences of people with MPN SVT, especially the psychological impact, which we've heard a bit about already today. And this makes it difficult to fully address their needs. So our study aimed to fill this gap, and the two main questions were, how do service users experience MPN SVT and the healthcare they receive? And also, what are the experiences and views of healthcare professionals regarding the MPN SVT care pathway? So we're using an approach called experience-based co-design, or EBCD, which involves service users and healthcare staff working together to develop healthcare interventions and improve services. And there are two aspects to experience-based co-design. There's the experience gathering phase, and then there's the co-design phase. And the study that I'm presenting today focuses on the first phase of the EBCD, so the completed experience gathering phase, which is highlighted here on the slide. So key features of the experience gathering phase are narrative interviews and observations. It's very much focusing on lived experiences. And by drawing on the personal stories of service users and healthcare staff, we identify what we call touch points. And these are the key moments that shape people's overall experiences of their care journey and highlight areas where improvements are needed. In line with the EBCD approach, Interviews with the service users were filmed and extracts were edited into a film depicting these key touch points. And this is called a catalyst film because it will act as a catalyst for the co-design phase of the study. And for the co-design phase, service users and healthcare staff will come together in workshops to view the catalyst film and hear the feedback from staff interviews, and then collaboratively design solutions which should ensure that changes are grounded in real-world experiences and meet the needs of those directly involved. So it's very much a partnership approach between the service users and the staff. We interviewed 18 healthcare professionals about their experience of delivering care for MPN SVT patients, including haematologists, hepatologists, specialist nurses, and specialist pharmacists. And a diverse group of 16 people with MPN SVT also took part in the study. They were aged between 31 and 65, with a median age of 45. 8 women and 8 men took part, and it was also an ethnically diverse sample. Time since diagnosis varied from a few months to 5 years, and some lived close to their specialist centre, with others having to travel further, with one person describing a 6-hour kind of round trip to attend specialist clinic appointments, for example. 10 were diagnosed with essential thrombocythemia and 6 with polycythemia vera. And 11 of the 16 were diagnosed with the blood clot before receiving the MPN diagnosis. Because service users' experiences are at the heart of EBCD, and because I'm very conscious that I've got limited time, I'm going to focus on the interviews with the service users for this presentation. However, there was a lot of overlap in the issues discussed by the participating healthcare professionals. And the main touch points for service users were experienced at different stages throughout the diagnostic and care pathway, and were often experienced more than once. And they can be organised into 6 main categories, which are represented in no particular order on this slide. Participants' journeys to diagnosis were very different, with a couple being diagnosed by chance, for example, following routine health checks, maybe via work, and describing no or mild symptoms, while others became critically unwell before being diagnosed and required emergency surgery. Several reported accessing healthcare more than once, often several times, and being misdiagnosed before receiving a diagnosis of MPN SVT. I'm now going to show you some examples of these journeys to diagnosis, which were extracts from the filmed interviews with service users.
I was not suffering from any symptoms or none that I could think of in any case, so I was just leading a normal life. And then one of the employers, they organized the usual health checks, and essentially just one of the blood tests turned out that it was slightly off.
For me, it started with stomach cramps, what felt like stomach cramps at the time. I put up with it for about a week. Because it was a case of whenever I ate, I was in excruciating pain. Could not work out what it was.
I went to A&E. I was still sort of sat there at 3 o'clock in the morning in an incredible amount of pain. I just decided I had to get out and go home and be more comfortable. Probably a terrible decision at the time. I then went back to A&E, as white as a ghost. Being sick, I could barely stand up at that point, and they sort of wheeled me straight through, sort of as a quite obviously very unwell looking person. Did a CT scan, at which point I think they realised the blood clot was there, and then it all sort of got very serious from there.
Went to A&E. Thankfully I had an amazing doctor there, but she was like, I can tell you're not well, I can see you're not well, but I can't actually find anything that's wrong, because at the time my bloods were normal.
That first day was particularly tough, because once he told me that there was a blockage, they didn't know why, they could see the blockage, and I said to him point blank, will I live or die? And his answer, and I'll never forget it, was, I don't know.
So despite this range of experiences leading up to diagnosis, it was possible to generate themes with relevance across the data. I'm now going to summarise the 6 touchpoint categories, but if you're interested to see the full Catalyst film, there is a version of this on the MPN Voice YouTube channel, which depicts many of the issues I'm about to discuss. So first, a difficult health condition to understand refers to how MPN SVT is a rare and complex dual diagnosis. People talked about finding it difficult to understand MPN SVT when first diagnosed and being confused by the often impenetrable medical language used to explain it to them. While some found, many went on to Google, Dr. Google as someone called it, to find out more information. And while some found a lot of helpful information, not least the MPN Voice resources, others described finding information online that was conflicting, confusing, and often frightening. Participants identified a need for more accessible, trustworthy information that was specifically about MPN and SVT combined. Several also spoke of challenges talking about their diagnosis with significant others who also found it difficult to understand, and this could impact how supported they felt. Finally, there were references to a lack of knowledge about MPN SVT among many healthcare professionals, which negatively impacted trust in healthcare received, for example, in general practice or if attending A&E. Undergoing investigations and treatment were also key moments. And while they appreciated the importance of investigations for diagnosis and monitoring, several described a lack of accurate information and support around investigations, such as bone marrow biopsies, with some still feeling traumatized by their experiences. Many wanted the option to be sedated for procedures like this. Again, participants understood why they needed to take medications, but starting treatment was also a touch point for some, particularly starting chemotherapy. Some reported good information support around this, but not all. Day-to-day medication management also had a substantial impact on people's lives, particularly if they were on warfarin, and some preferring the DOACs like apixaban if this was an option. Finally, living with the side effects of medications and worry about risks associated with long-term chemotherapy and anticoagulants also impacted people's overall well-being. And that moves us on to the need for support. So many spoke of challenges adjusting to a new normal when diagnosed and living with MPN SVT. And I think it's already been mentioned, the uncertainty of living with an MPN as well. And described needing emotional and psychological support, particularly around the time of diagnosis. And access to psychological support was described as patchy, with some seeking out private counselling. Some also mentioned financial insecurity due to the impact of MPN SVT on their capacity to work, which points to support needs in this area too. The fact that MPN SVT is rare and poorly understood contributed to feeling unsupported, as I've already said, so people spoke of feeling like they were falling down a bit of a gap. Finally, peer support from others with MPN SVT, which I know MPN Voice offers with the Buddy scheme, that was considered really invaluable by many, and both for emotional support but also for practical information and advice. However, not all had access to this, or they maybe weren't aware of where to access it, so maybe signposting is needed. Managing a complex care pathway was a key theme coming out of the data from both service users and healthcare professionals. As already mentioned, people with MPN SVT often have to access their healthcare across several different teams and settings, and participants described a lack of joined-up care. And this was often attributed to poor communication between professionals, specialties, and organisations, and to a lack of IT interoperability. Can't say that word. Therefore, navigating their healthcare was experienced as confusing, frustrating, stressful, and time-consuming by many. So some appreciated being able to access all of their healthcare for MPN SVT in one place at a specialist centre and really kind of valued that. But the cost of travelling to the specialist centre, both time and money, meant that some preferred to access some aspects of their care locally. But that could lead to more kind of complicated communication issues. And finally, many described touch points involving interactions with healthcare professionals that had a powerful negative or positive impact on their overall experience of healthcare. Continuity of care from professionals who recognised them and understood their individual circumstances and needs was valued by service users, but wasn't a reality for all. Service users' perceptions of a clinician's knowledge relating to MPN SVT also affected how they experienced the interaction. So people really valued speaking with experts in MPN SVT. And last but importantly, small words or acts of kindness from healthcare professionals really had a substantial positive impact on people's overall experiences. So, to conclude, this study provided powerful insights into the experiences of people with MPN SVT and the healthcare professionals involved in their care, and highlighted key areas for improving these experiences. And findings from the study, including the Catalyst film, will inform the next phase of this wider EBCD project, the co-design. And we've just started the co-design study, which is being funded by the Royal Free Hospital. This involves service users and healthcare professionals working collaboratively to develop new resources and care processes with the aim of improving experiences. And obviously then we'll need to evaluate these study outputs to gauge how feasible and effective they are. Thank you very much for listening.